Good morning. My name's Neil Heinen. I'm the editorial director at WISC TV and Madison Magazine. And 6 weeks ago, I turned 60. So thank you very much for addressing this right now. I can envision a very practical application for all the work that's done today. And more importantly, last week my 10 brothers and sisters and I got together to discuss the care of my parents, who are blessedly still living at home together. But we had the conversation about the 31-day pill box in the kitchen and what's in there and how does it get in there, and do we need to keep a closer eye on that, and all those things that we're all dealing with in one way or another. So again, thank you for taking this on in this community at this time, and for your willingness to participate in the public launch of the Safe and Healthy Aging Initiative. There's about 230 people here today, which is really impressive, including 70 healthcare providers, about 120 social service providers, and maybe 40 or so caregivers, volunteers, and older adults. So you can see, this is really an incredible community collaboration that's come together to prevent adverse drug events and falls in the population that is experiencing tremendous growth. And let's not forget that among all of the accolades that Madison's received over the last 15 years or so, one of them was as a city in which to grow older. This was, we've been acknowledged as one of the best cities in the country for senior citizens to live, and it's probably unfortunate that we haven't addressed these issues before, but extremely important that we address them now as that population continues to grow, and we want Madison to continue to be a great city in which to grow older. So it's exciting to see so many partners working on prevention and to create a focused public health message for the community. What's it been, 2 years now, Leslie, since Leslie and I had lunch, and we were sitting downtown outside, and Leslie was passionate, big surprise, right? Passionate about this new discovery spawned by her own family experiences about adverse drug effects and what can be done. And the potential for improving quality of life if we can do something about adverse drug effects and some of the other issues having to do with safe and healthy aging. So we've got a lot to get done this morning, and a lot that will get done. It's a pretty tight agenda, and so we're gonna try really to stay right on time. Between now and 10:05, a number of community leaders and delegation members will share their learnings and findings from the delegation process, and will announce community goals and exciting projects aligning with the strategies that United Way's Delegation on Safe and Healthy Aging has recommended. We're going to take a 10-minute break between 10:05 and 10:15, and then we're going to break into three groups. And the three groups are healthcare providers and staff from health systems. The second is social service providers, and then the third group of caregivers, volunteers, and community citizens. And we will launch the geriatric toolkits on adverse drug events and falls that delegation members and community partners have developed with United Way. So that's the agenda. Good stuff, a lot to get done, but a lot that will get done. And we'll leave this meeting today with a real clear action plan for significant change in our community again. Health and safety issues of seniors are, as I said, becoming increasingly important as the population grows, and we all know that it's growing. United Way, as always, is proactively addressing these concerns with this initiative that we're launching today. So we'll start our discussion by hearing from Leslie Ann Howard, the President and CEO of United Way of Dane County, And Leslie's going to help us really bring to life this very important topic and set our agenda of changing the course of aging. So please join me in welcoming Leslie.
What happens if I put my remarks down? There's a keyboard up here. I feel like if I start punching it in, it's going to put things up on the board or something. Well, good morning. Sorry. It was just I didn't realize that was sitting up here. It's great to have you all here. It feels like we've been in the starting blocks for a long time, so we're really excited to get started today and so pleased that we're all able to make it out. Sorry if you had to walk a little way to park your car, but hopefully you all made it in all right. I think everybody here is aware of our agenda for change and probably the work that we've done in academic achievement and homelessness and whatnot. We've been talking a lot about that over the last number of years in the community. It really has taken us a little bit longer to ferret out the appropriate focus for United Way in the area of working with seniors and health. Quite frankly, we struggled a little bit on that, and we've got two priority areas in the health area, and one is to identify and treat health issues early, and the other is to support seniors and people with disabilities so that they can stay in their homes as long as possible and remain independent as long as possible. And frankly, we started off focusing on caregivers, and while we found a lot of good things to work on there, I don't think we felt, the board and I felt, that we really had found kind of that really important leverage point that could make the big difference that we want to make with the few resources that we have compared to the size of the need. So when we looked at the aging population, I just want to start off and give you a little bit of context. Probably everybody here knows all this data, but in 2009, Dane County had almost 49,000 residents who are 65 years and older. That represents about 10% of our population, and that's up 23% since 2000. And in 2011, really the first of the baby boomers are going to turn 65. I feel like we've been hearing that for quite a long time, right? And many of us are in that category. So the number of seniors is really expected to rise dramatically. The population that's aged 65 and older is going to increase 130% by 2030. So that's going to take us up to 112,000 people who are over 65. That will represent 18% of our population. So think of that, Joe, as the county executive. You know, you're talking about really the nature of our community changing dramatically over the next less than 20 years. And the frail elderly population, which is 85 and older, right now stands at about 7,200, and that's going to increase by 84% by that time. So we're really talking about the needs of that population. Really, of many of us in this room, and that population is going to be growing and is going to need our attention even more. One of the things that got our attention at United Way is this rapidly growing senior population is going to become a bigger part of our community than ever before, and then with the limited resources that we're hearing more and more about, that are really outstripping our ability to respond, caused us to really try to take a look at where could we strategically put our focus to have the biggest impact possible. Could we really identify tipping points that would cause the preventable disability and dependence of our older residents, and that also increases the burden on their caregivers? Our hypothesis is that by leveraging resources on focused triggers, we will prevent or delay the functional decline of aging adults, and thus seniors could maintain a level of independence that would minimize their deep support from caregivers and their need for institutional care, most importantly. So we have this hypothesis, but how do we determine if it's achievable and how do we attack it? So what do? Well, we go to our best thinkers, our great volunteers, our volunteer well, and we ask those leaders to get a group together to figure out what to do about it. So we asked Tom Walker, CEO of Midwest Family Broadcasting and a member of the United Way Board, and Dr. Andy Kossoff, who's SSM Medical Director of System Clinical Improvement, to take the lead on that charge. And wow, it took them a while to work on it, but thanks to their leadership, we put a delegation together. We had 38 local professionals that represented, as always, every area of our community. We had medical professionals, pharmacists, social service providers, faith community leaders, business people, and the media involved to really look at this problem, look at this hypothesis, and see what we could do together to do about it. And you're going to learn a lot more about this, and this is what you're going to hear about today, but through the review of the research and best practices, we found that we could have a dramatic effect on keeping people and keeping seniors independent by looking at adverse drug events and falls. And that's when I got really excited, because, boy, it just hit me at a level of knowing, you know, when you hit the right issue and you really know it's the right thing at your gut level. And that was, you know, really what became apparent to me. So we set the goal to reduce falls by 15% by 2015. And you know what is phenomenal? It's kind of like, do you ever notice when you buy a new car and then you notice like that car everywhere in town? You know, or like, oh God, everybody's got the same car. In the same color, exactly. Well, what was really amazing as the committee was doing its work, and I became sensitized to the issue, just like when you have a car and then you notice it all over the place, I learned that my mother was taking 16 medications. I also learned that, and she thought it was great. I've been working on her for 2 years. I also learned that my father-in-law, by actually being in there and observing, was incorrectly administered an oral medication to his eyes that caused tremendous pain and tremendous damage to his eyes. Had I not been going through this, though, I don't think it would have been on my radar screen to even notice that something odd might have been happening. But what's more interesting than my personal experience, and Neil talked about his, every single person I talk to has either a personal experience, or when they start talking to their family about it, they realize there's an issue here. I mean, it just, people jump out of their seats. So that's when you know you've hit the right issue, is when it's affecting so many people and that people realize, wow, I've got to go back and check on this. So I don't think I can overstate the positive effect that our work on this can do, and that the work that we're going to all do together over the next number of years. I think it's going to have a huge effect on our senior population and to all of us in this room who are headed that way. It's something that really needs to be on our agenda. So on behalf of the community, on behalf of all of those who have worked on this, I am so grateful for your work. I'm so grateful for the work of our task force and our delegation. And I'm really looking forward to what we're going to come out with today that's going to carry us forward to work on this issue. So it's my great privilege to introduce our board chair, Jim Reardon. Jim is the head of Wisconsin Physician Services, as you probably know, president and CEO there. He's been a volunteer with United Way, chaired our campaign. He's held virtually every volunteer job at United Way. And he not only provides critical leadership to his company and to United Way, but he's passionate about this issue. He's a leader in the health industry. So please help me welcome Jim to the podium to keep us going this morning.
I started to worry a little bit when she said there's a keyboard up here, because I got papers to lay down, and that means they're going to slide around, but hopefully I can keep them in place. It's a great honor to be here today as Chair of United Way and as President of WPS to talk about, again, another opportunity through United Way to make a difference in our community. Like so many employers in Dane County, the WPS workforce are caregivers, and we see that firsthand the stress that can be placed on individuals who are trying to balance their jobs and caring for senior family members or neighbors when falls or adverse drug events cause increased medical needs at home that require their support. Having a senior population that is healthy and an active part of the Dane County community is important to the quality of life in the community. This helps WPS attract and retain top talent for our workforce. As an insurer and an administrator of healthcare benefits for seniors, we understand the costs involved with treatments for these healthcare services and these afflictions. The savings from preventing avoidable falls and adverse drug events can lead to everyone seeing lower health insurance expenses and lower public financing needed for senior care. You may not know this, but government programs, healthcare programs, reimbursements are lower than private payer reimbursements. Therefore, there's a shifting of cost to private payers to cover full costs of medical services. Any reduction in senior care services will help reduce employers' and individual health care costs. Through participation in the Delegation on Safe and Healthy Aging, we see the opportunity and wisdom in this United Way-led initiative to reduce the number of falls and adverse drug events that lead to emergency room visits and hospitalizations. WPS is pleased to be one of the sponsors of this initiative to create public awareness and action to prevent unnecessary hospital utilization related to adverse drug events and falls. This initiative will have quantifiable outcomes that are directly tied to the quality of life of a growing segment of Dane County's population. As United Way Board Chair, I would like to recognize and thank the volunteers of the Self-Reliance and Independence Community Solution Team who began investigating the issue of functional decline of older adults for more than 2 years and are currently working on a number of projects to implement strategies to achieve our goal. I'd like to recognize former Chair Dan Raschke, CEO of Total Administrative Services Corporation, current Chair Enid Glenn, Section Chief in the Department of Workforce Development of the state of Wisconsin, for their visionary leadership and deep commitment. I also would like to thank each member of the Delegation of Safe and Healthy Aging, a group of 45 local professionals in the community with various expertise, who committed themselves deeply for more than a year to guide United Way and its partners to determine the right direction and monitor its progress. Tom and Andy, thank you so much for your leadership on the birth of a new initiative. At this time, I would like to introduce Dane County, got ahead of myself here. Dane County government supports major investment in our services for the aging population. And I'd like to introduce Joe Parisi, our Dane County executive, who's hard working to develop the county budget and maintains this important leadership role. His presence today demonstrates that commitment. Please join me in welcoming County Exec Parisi as he shares his vision and support for this initiative.
Good morning, everyone. Well, what they didn't tell you is that there's a picture of the person speaking up here, so I'm staring at myself. I'll just do that. Sorry. Wow. Sorry about that, guys. Jim, thank you so much for your commitment and leadership and all the time and energy you're putting into this project. And Leslie, all you have to do is sit back there first thing in the morning and look at you to see the passion and the commitment and the knowledge you bring to not only this project, but all of United Way's goals. And thank you so much. And Neil, it's always such a pleasure to share a podium with you and see you dabbling in so many important issues around the county, and we appreciate everything you do. And thank you to everyone here today for all the work you're doing, and hi Betsy, and for being here. Sorry, I haven't seen Betsy in a while. And for being here to focus on this incredibly important issue. You know, as you know, Madison and Dane County are regularly recognized as some of the best places to live in the nation. Not only our schools, but our lakes, the incredible quality of life that we have here, the incredible diversity from urban to suburban to rural, our natural trails that are just 5 minutes away from our urban centers, our agriculture. It's just an unmatched place to live. But this list wouldn't be complete without recognizing our human services and the commitment that we have to helping people in our community. And Dane County government has a strong commitment to programs and services for our more than 67,000 current residents aged 60 and older. 67,001 currently 60 and older. I didn't mean to point you out, Neil, but Neil's just such an inspiration for that time long in the future when I hit 60. I hope I'm going as strong as Neil is by then. But I'd also like to recognize, is Lynn Green still here? You know, when we talk about human services, our human services director, Lynn Green, does such an incredible job, particularly in these days of shrinking budgets, and her commitment is so strongly appreciated. Lynn, I just wanted to thank you so much. I know the supervisor, thank you. And this is dangerous when you start pointing people out, but I just recognize Supervisor Paul Rusk, who's with Lynn today, too, who has such a strong commitment to this issue. And today is just one more example of our community coming together to improve the quality of life for older adults, their families, and their caregivers. Under the United Way's leadership and generous financial support, we're also here to learn more about keeping older adults safe, specifically falls and adverse drug events, incidents proven to be turning points that lead to ER visits, hospitalization, and more dependence for older adults. And I had a kind of first-hand experience with this recently when my wife had some ankle surgery. And I just want to be clear, I'm not referring to my wife as an older adult. Okay. Even though those ARP cards started coming a couple of years ago, I still can't get myself to open that envelope. We just put them in the recycling bin and think it must be some kind of mistake on their listserv. But my wife had some ankle surgery, and she couldn't put any weight on her ankle. And about the second day, as she was trying to maneuver her crutches, she fell. And the bruises on her knees and her arm and her side that she got from that fall were almost as bad as the ankle surgery itself. And so it just got me to thinking, especially as we get older and our bodies don't move like they used to and our bones are more brittle, it was just such a first-hand view of the impact that a fall can have and what a life-changing event that can be. So it just drove home the importance of what we're doing here today for me. Now, the Dane County Area Agency on Aging has long promoted programs to maintain independence and good health for older adults. Programs like Stepping On, Living Well with Chronic Conditions, Only Leaves Should Fall, and their medication management services. And now United Way takes us to a new level with the Healthy Aging Initiative to address this issue. Again, my deep thanks to the United Way for the scope and the resources it's bringing to this important issue and for the opportunity they're offering older adults in our community. So I hope you have a wonderful program today. Thank you for inviting me to take part in it. And I will now introduce someone who I've known for a number of years whose commitment personally to so many of the issues we care about is incredibly strong, as is the person she's here to represent, Darcy Loma, who is the district director for our good Senator Herb Kohl.
Good morning. I knew there was energy in this room. I feel it. I am so pleased to be here today on behalf of Senator Kohl, who sends his warmest regards. He's had a very busy August recess, traveling to every region of the state, attending Rotary lunches and local farmers markets and SBA events and touring manufacturing plants and biopharmaceutical companies. And he asked me to send his greetings today, that he couldn't join you today personally. He also has spent a lot of time at the State Fair Milk House, where they now serve 5 flavors of Wisconsin milk for a quarter still. My name is Darcy Loma. I've been with Senator Kohl for the last 10 years, and I'm pleased to be here today to provide an update on some federal issues that are happening as it relates to seniors. And I need to just say, on a side note, I just put my daughter on the bus for kindergarten for the first time, and I've got some anxiety that I wasn't expecting. Sounds like some of you can relate. As many of you, and most of you probably know, Senator Kohl is the chairman of the Senate Special Committee on Aging, where he's a recognized leader in efforts to protect older Americans. He's also a member of the Appropriations Committee, where he has fought to preserve heating assistance for Wisconsin senior citizens. And I just realized I did what everybody else was nervous of doing. To increase funding for Alzheimer's disease research, to improve support services and long-term care for the elderly, and to strengthen oversight of nursing homes and other long-term care facilities. Senator Kohl works to protect seniors' access to quality health care and to reduce their prescription drug costs. And he's committed to making sure that Medicare is preserved as a vital health program for seniors. When I asked the staff on the Special Committee on Aging for some talking points that I could share with you on what's been happening and what the Senator's been working on specifically, I am no kidding. I got 13 pages single-spaced. I will not be sharing all of those with you, and I invite you afterwards to connect with me. I can share a lot more details, but I'm just going to touch on a couple of issues that I think are of particular interest and importance. And I'm going to start with a topic that's one of your themes today, falls prevention. Senator Kohl recognizes the importance of fall prevention programs for older adults, given that falls are the leading cause of fatal and non-fatal injuries for those 65 and older. For the past 2 years, Senator Kohl has sponsored a resolution to designate National Falls Prevention Awareness Day in September, and he plans to reintroduce the resolution again this year. Senator Kohl also worked to ensure the inclusion of language in the American Recovery and Reinvestment Act for evidence-based disease prevention and wellness programs, including fall prevention programs. I'm going to touch just briefly on the health reform bill, the Patient Protection and Affordable Care Act. This bill contained a number of provisions championed by Senator Kohl, and the benefits of health care reform for seniors have already started to roll out. A couple of the highlights include the Patient Safety and Abuse Prevention Act, which is a policy that prevents those with violent or criminal histories from working with vulnerable elders in long-term care settings. Medicare, none of the provisions in the health care law will cut the benefits Medicare participants have come to rely on, nor will they increase the out-of-pocket expenses seniors pay. Under the new law, Medicare beneficiaries are able to keep going to the doctor that they prefer. And the donut hole in Medicare Part D prescription drug benefit, which costs many seniors thousands of dollars in out-of-pocket expenses, I'm happy to say is being phased out. Seniors in the gap will now receive a 50% discount on drugs. And by 2020, the donut hole in the Medicare prescription drug benefit will be completely phased out. And beginning in 2014, it will be illegal for insurance companies to refuse to cover or to charge exorbitant rates to those with a pre-existing condition. Affordable prescription drugs. Senator Cole has long been concerned about the high cost of prescription drugs, which can make it hard for Wisconsinites to afford the medicines that they need. He believes it's not fair to ask Americans to pay higher prices for the same medicines that cost a fraction of the price in other countries. And he held a hearing examining this last month. He's also co-sponsored 2 bills on this issue. One would allow FDA-approved prescription drugs to be imported from other countries at substantially lower prices. And the other reduces the anti-consumer practice of brand name drug manufacturers using payoff agreements to keep cheaper generic equivalents off the market. I'm going to conclude my remarks this morning by talking a little bit briefly about the budget and Social Security and Medicare. In the first 5 months of this year, the talk in Washington has been locked on the federal deficit, and understandably so. Senator Cole believes we need to get our deficit and our debt under control, and he believes we can and we will do that. But to get there, we need bipartisan collaboration. And he believes we must not be afraid to dismiss claims that are simply untrue, like those that tie Social Security to our debt. Social Security is not busting our budget. In fact, it has never contributed 1 cent to our deficit. But it does face long-term shortfalls that need to be addressed. The changes that need to be made to get Social Security back on the right track for future generations are relatively small and very achievable, especially if both sides work together. Too often these debates focus on dollar amounts and ignore the impact many of these programs have on the lives of millions of Americans. Without a monthly Social Security check, nearly half of our nation's seniors would live below the poverty line. More than 1 million people in Wisconsin receive disability, survivor, or retirement benefits from Social Security. That's 1 out of every 5 people in our state. The benefits, however, remain very modest, with the average beneficiary receiving just $14,000 a year. Senator Cole believes that if we hold true to the core principles of the program, Social Security will continue to be the foundation that Americans build their retirement on. And even more than Social Security, Americans rely on Medicare when they retire. Without it, an unthinkable number of Americans would be left penniless by a major illness. Families that are planning and saving toward their retirement count on Medicare as their primary health insurer, as for many, buying private health insurance is simply not possible. Senator Cole believes Medicare needs to be mended, not eliminated. We should consider ways to provide care more efficiently by paying for health care based on the value to the patient and not on the number of medical procedures. Medicare and Social Security provide peace of mind to retirees after a lifetime of hard work and are important programs that keep millions of seniors out of poverty. While Social Security faces a long-term financial problem, it is not in a crisis and it is not going broke. Social Security can pay full benefits for another 30 years, and after that, even if nothing were done, Social Security could still pay 75% of promised benefits. Senator Cole believes that we need to cut costs in these programs by being more efficient and not just shifting rising health care costs onto the backs of seniors. I thank you again for the opportunity to be here today on behalf of Senator Cole, and I welcome at the break any comments that you would like me to take back to him. Thanks.
No question, championing senior issues is going to be one of Senator Herb Cole's legacies. I mean, he's done it since the day he got into office. But I think the biggest change in November for me is going to be after 10 years going to events like this and wondering, where's Darcy? She's been at every one of these for the last 10 years in this community. Look, it's now time to hear from our co-chairs who have led the collaborative community efforts for more than a year with the work of the Delegation on Safe and Healthy Aging and all the projects that we have developed after the work of the Delegation. So please welcome Tom Walker, CEO of Midwest Family Broadcasting Group, and Dr. Andy Kossoff, SSM Medical Director of System Clinical Improvement. Tom and Dr. Kossoff will announce community goals and strategies from the Delegation on Safe and Healthy Aging.
Thanks, Neil. I'm Tom Walker, and it was my pleasure to be one of the co-chairs with Andy on this Safe and Healthy Aging delegation. Personal story, when Deidre approached me to be one of the co-chairs on this, how did she convince me to do it? First, she told me it would only take 6 months. Year and a half later, here I am, so thanks, Deidre. But about 9 years ago, it'll be 9 years in this December, my mom took a fall. The technical term is that she dusted her elbow by the doc who put that together, and has been in assisted living ever since. And more importantly, once she got to Oakwood and we were able to get her meds under control, we cut her meds about in half. And what caused the fall, why she fell, and whatever, that's ancient history. But more importantly, my dad was left at home alone after that, and 9 months later, he was dead. He had no fun going back home anymore, and I think he just gave up. So, it's not only the fall and what that does to the person that survives, but what happens to the rest of the family, and that's where my heart is on this whole thing, which is why I'm still here doing this stuff and so excited about what's going on. Our delegation started its work by looking at a lot of different triggers and things that can cause falls and the like, and we quickly came down to 4 main triggers that we spent more time on. One is adverse drug events. Secondly was the falls that we've talked about. Third and fourth, incontinence and dementia. Knowing that we're United Way of Dane County, and even though we'd love to get into incontinence and dementia issues, really that's a little beyond the scope of what we can do in Dane County as far as dealing with Alzheimer's and the like. So after looking at national local data and looking at the evidence and whatever, we set a set of community goals and strategies that really lasers in and focuses in on 2 things. One is falls, and the second was ADEs, and knowing full well that there are forms of medical and I'm a broadcaster and an accountant. I'm not a medical person, but some dementia can be caused by bad drugs and the wrong mixture of drugs and the wrong self-medication, and also there's levels of incontinence that can be brought around by bad drug use and the like. So we really lasered in on the 2 things that we thought we could do something about locally, and that was the ADEs and the falls. Our goal is now, as a delegation that we took to the United Way board and they approved, was to reduce the number of admits to ERs, the resultant hospitalizations, by 15% in Dane County by 2015. We think it's an achievable goal. We think it's a realistic goal, and we're excited about the product that the delegation, and I thank all of the delegation for putting up with the starts right on time and the getting out on time, and the 10 minutes to talk amongst yourselves was 10 minutes, and I apologize for anything I might have said to get you to move from one small group to another, because I was that person. Andy, on the other hand, was the warm, fuzzy, gentle, good-looking guy in the delegation. So Andy's now going to come up and talk about some of the data that we learned and key strategies that we're going to be doing. Andy.
Good morning, and I must say it's been a pleasure working with Tom, although if I can kind of speak confidentially to you, it's been very hard to keep up with Tom's rigorous dress code. So as we talk about some of the specifics now of the delegation's work and now the United Way's work and our community work, and look at some fairly sobering statistics, I think there's a couple of things that are very important to keep in mind. Every senior citizen, their families, their caregivers, case managers, social service providers, and healthcare professionals are trying very hard to reduce falls and adverse drug events. There's lots of activity in this community that's going on. What makes, in my opinion, this United Way effort so incredibly unique, and I might even say cool, is that it's going to create a focus and a priority on these two very big problems for senior citizens, and is going to coordinate all the individual and organizational activities within the community and insert some proven prevention strategies, so that I believe that with this United Way effort that we're going to move to a far greater level of prevention and really make this community a model for safe and healthy aging. Let's talk first about adverse drug events, which are the undesired and unintended effects of a drug that causes patient harm. And this harm can range in severity from bothersome side effects to death. Here we have a graph that shows some of the data from Dane County. I'm a little graphically challenged, so I'm going to try to simplify this a bit for you. The bars show the actual number of hospitalizations in each of the 3 senior citizen age groups, and the lines show the percent of all hospitalizations in each of the age groups, the percent that's due to adverse drug events. It's a huge problem. In 2009, which is the most up-to-date data that we have, 86 emergency room visits and 1,500 hospitalizations for older adults because of adverse drug events. And adverse drug events are responsible for full 11% of the hospitalizations of senior citizens. So a very big problem. Prescription medication use increases with age because of increasing chronic conditions. There are many well-researched reasons why these adverse drug events may occur. One, the simplest, is an unpredictable effect of a medication that nobody knew about, use of multiple medications, or what's sometimes referred to as polypharmacy, lack of good patient education about their medications and the use of medications, patient non-adherence to a particular medication regimen, or using over-the-counter drugs that may cause some interference with the other medicines they're taking, and failure by the medical community to adjust doses for senior citizens, and also the use of some particularly risky medications in senior citizens. So there's lots of reasons that adverse drug events can occur. It's pretty clear that with a good community effort, we can make a real difference in those. Now let's turn to falls. Older adults are at significant risk for falls and injuries, which lead to chronic disabling problems, can be a major reason for institutionalization and loss of independence, and on an individual basis are very devastating for senior citizens. Falls are the leading cause of unintended injury in Dane County, and you might be interested to know that of all the states, Wisconsin has the second highest rate of death from falls. This is a leaderboard that you certainly don't want to be on. It's just an incredibly large problem. 1,400 emergency room visits and 20 to 40 deaths occur every year in Dane County because of fall-related injuries to senior citizens. A lot of people think that the Wisconsin data, or thought anyway, that the Wisconsin data was that we have very tough winters here. There's a lot of ice and snow, and people fall. This graph actually shows that that's probably not. It's not that simple anyway, because as you can see here, in the warmer months, actually as many or more falls occur during those months. So nobody really knows the reason for the high rate of falls in Wisconsin. Speculation has been that we have a higher gravitational force in Wisconsin, and also that we have a higher consumption of beer and brandy, and one other part of this equation is that we have very excellent public health data reporting, so some of it may be artifactual by the fact that we just do a better job of reporting those incidents. If we could look at the next slide. This again is sort of a complex slide about the incidence of falls in Dane County, but the point is that hospitalizations and emergency room visits are increasing because of falls. The costs are staggering in this community. It's about $20 million in community costs for falls, and in the nation, the bill is $18 billion about 2 years ago. So it's a gigantic problem, and this also is something that we can do things about. So what's to be done about falls and adverse drug events? You'll hear more during the day about all of the plans that United Way has developed for reducing these, but a well-designed community initiative that coordinates roles among medical professionals, senior citizens and their families, and social service agencies can be effective, very effective, in reducing both falls and adverse drug events. For example, if pharmacists and physicians systematically review a patient's medications, and we can make a difference in adverse drug events. And adverse drug events and falls are actually quite related. I think that Neil had sort of mentioned that, but the issue is that if an adverse drug event causes someone to be dizzy or unsteady on their feet, that actually can lead to a fall. So these are really related problems. And in addition, if senior citizens can be convinced and directed to participate in specific balance and exercise training, the risk of falls can reliably be decreased. The delegation has identified 4 overreaching strategies to reach the goal of decreasing falls and adverse drug events in Dane County by 15% by 2015. And these are shown on this slide. The first is to identify and/or create tools and strategies to assess the risk of adverse drug events and falls for individual senior citizens. So the idea is that you need to find the patients, the people at risk for these, so that you can take appropriate preventive measures. To connect physicians and healthcare providers to resources at community organizations that can meet the non-medical needs of seniors, resulting in reduced ADEs and falls. And provide caregivers with access to resources and tools to help seniors avoid ADEs and falls. And finally, help the community to understand, act, and advocate for the prevention of ADEs and falls. So that's the general scheme, a little description of the problem, and I think Neil is next.
Thanks, Andy and Tom. It's my pleasure to introduce our keynote speaker next. Dr. Steve Bartsey is Deputy Director of Geriatric Research Education and the Clinical Center at the William S. Middleton Memorial Veterans Hospital, an Associate Professor at the School of Medicine and Public Health at UW. Dr. Bartsey was a member of the Delegation on Safe and Healthy Aging and is currently helping a number of safe and healthy aging projects to achieve our goals. Dr. Bartsey is going to give you a presentation on helping older adults to age in place, mobilizing the community. Dr. Bartsey.
So I am very fortunate to be a physician who specializes in care of older persons. So every day I get to hear great stories and really share individuals' lives in ways that I feel very privileged to. I think one of the visions of any member who works within the healthcare field or within the community and works with older persons is to try to maintain a level of independence, a level of quality of life that all of us would want to achieve. And the AARP and the vision of the AARP kind of, I think, encapsulates this nicely. In essence, we're looking to maintain productive, active engagement and high quality of life as long as we can. And really, there's a lot to that, but some of the key aspects are going to be the issue of preventing disease or preventing complications like we're talking about today. The issue of promoting health, there's all kinds of wellness aspects that are very key. And then talking about just the issues of what does make a person's quality of life, what they want it to be. Now, everyone here in the room can probably appreciate just a little bit the aspects of age on our own physique. And certainly we have a number of physical or biological, if you will, changes that just occur with the aging process. And likewise, in later life, there are lots of increased psychosocial challenges. And it's these combinations, the changes and the challenges, that can lead toward a series of what I call age-related problems. Some people kind of call this topic geriatric syndromes, and I'm going to introduce a few of these geriatric syndromes over the next few minutes. But in the end, if we don't address these geriatric syndromes, then there's a whole cascade of complications that can come. And we know this includes things like hospitalizations, but more importantly, functional decline, changes in location of living, and all the things that we've heard about from the personal stories that have been shared thus far. So speaking specifically about geriatric syndromes, really, as opposed to other medical conditions where you can target a specific organ, like heart attack, heart disease, you find that many of these geriatric syndromes represent phenomenon that have multiple factors all contributing that can lead toward involvement of multiple different organ systems. And so sometimes physicians, aren't quite sure how to lump it together because, you don't have a lot of fallologists out there. They're most every practitioner. But by and large, it's these issues, these broad scope geriatric syndromes that can exist together and can actually serve as barriers or as threats to many of our family members and community seniors. This is a laundry list for which I'm not going to cover, but I just wanted you to be aware of what I mean when I'm talking about geriatric syndromes. So there are things like acute confusion. Some of us in the health field call that delirium. There's the whole issue of dementia and all of its consequences. There's the falls, which we will talk about in a moment, incontinence, pressure ulcers, bone health and osteoporosis, dizziness, this whole idea of loss of muscle mass and strength and how that affects one's balance. These are all things that don't target one particular organ system, and sometimes that does make it a little bit more challenging for providers who are working on these topics. Furthermore, it's not that simple that there's just one geriatric syndrome per person. In fact, the reality is many of our older patients, older adults, family members, have a constellation of these issues. So just looking at this graphic for a moment, you can see, so a person might have a little bit of memory loss. And for that, they've been given a medication to help their memory loss. Now, it turns out that medicine, as one of its possible side effects, is it can cause a person to have more bladder twitching or irritability, which then causes them to have to run to and fro the bathroom more often. And with that, there might be incontinence. And if they happen to be in the wrong place at the wrong time and the carpet's just in the wrong location and they're rushing to that bathroom, then the fall may occur. And then all the constellation of other factors. So it's really not about one particular issue. It's weaving together a strategy to approach all of these issues. And I think that obviously what we're talking about this morning and what United Way's vision is doing that. We're looking at a couple key areas. There are a lot of ways that individuals might end up in their home and then months later not in their home. And so these pathways toward disability, if you will, are many. And I think that we just need to be sensitive about what some of those represent. Certainly, a complicated hospital stay can bring a person from here down to here very easily. And those of us in the health field see this regularly. We know that not just going from, say, the hospital to the home, but all the logistics involved with that transfer for one group of people to the next group of people, whether it be the health professionals or the caregivers or the patients themselves. Those transitions can be sometimes very challenging and risky. As we'll talk about more, adverse drug events, which are part of that process of the transitions, and sometimes are an unfortunate consequence of not getting the right medalist at the right time. The issues of falls, the issues of confusion, loss of muscle strength because you've been lying in a hospital bed for too long or sitting in a chair for too long because you're fearful about getting from one room to the next. And of course, certainly mental illness such as depression. All of these things pose a risk. Speaking specifically about adverse drug events, we know that the med lists can become quite impressive as individuals accumulate health issues over time. And certainly those health issues and those medications are appropriate. Practitioners, physicians, nurse practitioners, and others choose the best therapies based on good evidence. However, the challenge is when you've got 3 or 5 or 10 health problems, and every one of those health problems has a best practice, and then you mix it all together in a big pot, and you twist it, then all of a sudden you get something that's absolutely unique to that person alone. And there's no other person probably that's ever lived that has that exact combination of health issues, medications, and the like. So it gets harder for us as health professionals to address that. I won't get into a lot of details, but we know that older adults are much more at risk for having adverse drug events, that they lead toward lots of hospitalizations, as we've heard already. And importantly, they can be very subtle. And so they can be under the noses of all of us for a long time before we start to piece it together. There was a time when, a few years back, persons would be out on the farm, dropping dead in the fields from heart attack, and it would be a mystery. Why did that happen? Like a lightning bolt out of the sky. Why did that heart disease occur? We didn't at the time understand the risk factors for vascular disease. We didn't understand that we could modify those risk factors. Well, I want to fast forward to now, and I'd like to encourage all of us to be better aware. What are the risk factors for adverse drug events? Are they also a lightning bolt out of the sky? And I think many of us in the room recognize no. In fact, there are a number of predictable factors that if you add them together, they substantially increase a person's risk for having an adverse drug event. And I think we'll hear a little bit more about this through the course of the morning. But certainly numbers of disease processes that a person's living with, the numbers of doses of medicines they're taking, as well as the numbers of medicines. If a person's already had a prior problem with a adverse drug event, age, kidney function, these are all matters that we can lump together and we can make predictions. So this is a graphic of some of the different medications many of the people living here in Dane County are on. And you can see this is a big list, and you can see some medicines like antidepressant medicines and hypertensive medicines at the very bottom, those really long bars, are very, very common. And the challenge, of course, is, again, mixing these all together into that test tube and finding out what happens to an individual. And so we have to be very graduated, very careful, and always vigilant about looking for these issues. Now, looking at the numbers of medicines. In Dane County, the average senior is on 6.4 prescriptions. Now, 0.4 is a little harder to split than a 0.5, when you cut with the pill. But the idea here is that we know that as these numbers climb, you can see the risk for an adverse drug event climbs substantially with it. So at 6.4, that puts many of our individuals at probably almost a 50 to 60% risk for having some kind of an adverse drug event. Now, some of these may be subtle, like worsening constipation, but some of these are a bigger deal. As an interrelated issue, the whole circumstance of falls. You've already seen, we've talked about how meds themselves might predispose, causing a person to have some confusion, inattentiveness, dizziness, all of these things. And we know falls, too, on their own, distinct from adverse drug events, can be a substantial risk and burden. There's wonderful task force that are involved in this community that have been looking at this issue for quite a few years, and we're just kind of piggybacking on the great work that they've been doing. But we know that about 1 out of 3 seniors will have a fall in a given year. That at least a percentage, about a quarter of them, will have a severe injury as a consequence. And the things we've already talked about, the outcomes of those injuries, then can leave a person disabled or afraid for quite some time afterwards. And then, of course, there's a big ticket. What would a slide be without at least one number that had 1 billion on it? Well, this, of course, there's 1 billion there. So we talked about, no, not a lightning bolt out of the sky, but what are those risk factors for falls? And again, I'm not going to cover all of these categories right now, but as health professionals and especially as individuals that work with older adults, many of us are aware of these risk factors. And when you start adding those risk factors together, and you have 4 or more of those in either one of those boxes, then a person's chances of falling in a given year are approximately 80%. So we need to be able to look at. Now, it turns out the box on the left side, we have a little bit harder time adjusting. I can't reverse the clock if you're 85. But certainly some of those issues on the right side are ones that we have imminent ability to adjust. Issues of exercise, issues of medication adjustments, and the like. Lots of good environmental adjustments that can be made. And so these are the things we want to be targeting. You've seen this graph again, I'm just reminding you. It's these issues, it's the hospital stays or the ER visits for the falls and the ADEs that we're seeing this disturbing trend on. So, where do we go from here? We know already in this community that there have been a number of important programs that have been instituted through the Be Safe, through United Way itself, the Pharmacy Society of Wisconsin and this Wisconsin Collaborative, Sure Step, Stepping On. These are all things that maybe some of you in this community are very aware of. These are approaches to address these risk factors that we can address, as are listed here. The meds, vision issues, modification of environment, exercise and rehabilitation that's more than just what happens immediately after the hospital stay, the issue of dizziness and adjusting therapies for that purpose, as well as addressing the issues of pain, which itself can limit a person and make them more prone toward a fall. So in closing, I'm going to talk for just a moment or two more about, so how do we accomplish this? Because these are big ticket tasks that people have been talking about for a long time. And we've made progress, but we probably have some room to go. Unfortunately, this occurs in the backdrop of a challenging healthcare system. I'm not telling any of you in the room things you don't already understand or know. Our health system was originally developed to be reactive. We were there to address acute conditions and problems, and the hospitals did a very good job of doing that. And over time, as things got more and more complicated, we developed, and I had to use this in Wisconsin, silos of care. Okay. And many of us in the health field recognize these silos of care. So that's the hospital, that's the nursing home, that's the home care environment, that's other environments like assisted living, and each one of these has their own turf. And truthfully, although the patients and their families navigate through these areas, oftentimes the communication between these areas isn't quite what we'd like it to be. And we're working on that. But even so, these silos of care exist. Transmission of information can be a challenging task. As we take a person who was on 17 medications in the hospital, and they've got another 20 medicines at home, and then they go home and they've got this big pile and they've got to somehow reconcile. And we're working to try to help them reconcile, but sometimes it's not so easy. If we look at this mismatching then, so these are just a partial list of some of the challenges that we in the health field and in the community have to approach. This idea that the system was developed for acute care, but now we're doing a whole lot of chronic disease management, diabetic care, heart disease, all the like. We're looking at duplications of services. Things are done in the hospital, and then right away they go home or in the nursing home, and things are done again and done again. And so how do we correct for that? There are those geriatric syndromes I talked about, which sometimes don't have as high a visibility as other health diagnoses. You know, they're more subtle sometimes, and so they can be missed. The med areas we're just talking about, preventable injuries, which we're certainly talking about with the falls issue. And so what can we do? And this is, I want you to take a look at this. This was projected as a vision for healthcare from 1996, okay? So the question I pose to all of you, think about it, is where are we now? So before, for a long time, if you will, we would have this mass market business model of healthcare that was passive and reactive. There was a focus on a lot of costs, which is still a crucial issue, but sometimes it was debated whether that was a bigger issue. There was this idea that there was a gatekeeper. There was someone who was in charge. There was King MD. And I'm an MD, so I think I can get away with saying that. And there was a whole bunch of other people that were kind of below in the court. Well, you know, and truthfully, we've realized a long time ago that that's not a strategy when there are a whole bunch of other people who know a lot more about certain aspects of healthcare than physicians might. So, and of course, just this narrow clinical focus. So move over to the right side, the vision for where we want to be. We need to be more anticipatory, thinking about prevention, thinking about what could be done to change things for the future. There's more of a focus on senior-centeredness, patient-centeredness. How do we make it convenient for the patient, not just for the efficiencies of the healthcare system, whichever healthcare system we're talking about? Teams. I live and breathe and sleep and dream about teams as a geriatrician, okay? Because I realize that I cannot meet the needs of my patients nearly as well as me plus 2 or 3 other well-prepared individuals who might be health providers, who might be community partners or caregivers. The idea that it's a bigger group. Pharmacists, as you'll hear about today, can play a pivotal role. Likewise, therapists, many, many others, nurses, can play a pivotal role in the home, out in the community, where I'm not having that extent of that outreach as a physician, for example. And the idea that we want to be broadening our focus to things like these geriatric syndromes. Understanding there are risk factors for falls, there are risk factors for adverse drug events, and we can do something about it. So how do we do something about it? Okay, I promise if any of you study this chart too long, you will have a seizure, so don't. But the point is this is a vision for how do we do chronic care better. And I just want to point out 1 or 2 things about this circle. Really, really important to look at what's the far left component of this circle. It's community, resources, and policies. It's what we're here and talking about today. It's mobilizing people who have abilities, great gifts, passions, bringing them all together and figuring out how do we have people rise up to the highest level of their abilities, whether they're a health provider or whether they're a community caregiver, whether they're whoever. And so it's really important that that community piece is there, engaging and supporting those who are in the trenches, working not just 6 hours or 8 hours, but on call 24 hours, 7 days a week. How do we help those caregivers? How do we help the people living with these afflictions? And likewise, on the other side, how do we engage busy health professionals, including physicians, who have a lot of things on their plate? And we have to be very respectful for the things they have to do. But how do we connect it so that those busy health professionals, the community partners, many other important parts of this allow for that left lower box, which is we have informed, empowered patients and family. It's in the end, it's not going to be about what I know. It's going to be what my patient knows and what their family knows, and how do they react to a certain situation when it comes along. And so with that, I want to thank you all for this little bit of vision for the future. I'm quite confident that with the resources in this room, the resources outside of this room, that Dane County can continue to rise to be the level of quality of care and the profile that we have held in the past. And so I thank you all.
Thank you very much. Okay, I'm just going to ask a real quick question here. Are the panelists the experts that are going to be meeting with the groups? They are. Should we try to get a quick community response here, or should we have the panelists meet with the groups? Let's have the panelists talk a little bit about what each of them was. Okay, everybody get up here. I'm going to try to get us back on schedule, but if we can just get sort of a quick response, and then we can get into a more detailed conversation with the groups afterwards. Andy, you've already met. Robert Breslow is in the middle there with the School of Pharmacy at the University of Wisconsin. Dr. Paul Smith, Wisconsin Research and Education Network, Department of Family Medicine. Christine Beatty, Executive Director of the Madison Senior Center. And Betsy Abramson, who is the Deputy Director of the Wisconsin Institute for Healthy Aging. So I'm going to ask you just to keep your remarks very targeted and short if possible. You don't all have to answer every question, but certainly initially you might all just want to add a quick comment on what should a caregiver know about adverse drug effects and falls. Do you want to start, Betsy?
No, I'll let Andy start. Mine's more of a commercial, and I'd rather start with the doctors. Thank you.
Well, I think, can you hear? I think the important things that caregivers and senior citizens need to know is, number one, kind of the scope of the problem. It's interesting that we sort of have an individual view of this, so we know that a family member may have had a fall or an adverse drug event, but we don't have a community view of it, and I think that that's a very powerful message. I think that people need to know that they do in this current system need to advocate for their family members or themselves, be as knowledgeable as possible, and be free to ask questions of their healthcare providers as they're prescribing the medications, and also be alert to the fact that there may be non-medication ways to treat a problem so that you reduce the overall burden of medications.
Can you hear in the back? You can? Okay. Probably be important to speak into the mic. Robert, from your perspective, please.
Well, first of all, I want to thank United Way for its foresightedness in this huge problem of adverse drug events and falls. And I would like to say that I very much appreciate, on behalf of all pharmacists, being recognized for the value that we bring to patient safety and patient care. You're going to hear more about the Wisconsin Pharmacy Quality Collaborative from Chris Decker, the CEO of the Pharmacy Society of Wisconsin, so I won't be redundant with those comments. But I will be saying in regards to adverse drug events, you've heard much from Dr. Barzy and others, that as the number of disease problems increase in numbers, the numbers of drugs go up, and the incidence of adverse drug events and the risk factors certainly go up accordingly. Pharmacists are uniquely positioned because of our accessibility and the relationships that we have with patients to be very much involved in early detection of potential for adverse drug events and early intervention. By being a resource and collaborating with the rest of the healthcare community, and being able to send patients where they need to go to get the best help that they can get. So clearly, I'd like to say that this is a great opportunity for collaboration throughout Dane County's medical community, and I again applaud United Way for giving us that opportunity.
Thank you. Dr. Smith.
Well, the good thing about being... Do these actually work? Okay. The good thing about being in the middle is that 3 out of the 4 things I was going to say have already been said. But a little personal experience, taking care of my mother, who's 81, for the caregivers is sometimes you need to push the elder to do the right thing. And just they're often resistant to changing anything, changing the setup in their house, putting handrails up, taking those carpets away, whatever, or asking questions of the doctor, which is probably the biggest one. And so that would be my most important message is, someone said you need to be the advocate when they are out in the community and you're interacting with the healthcare system, and you need to push the elder to do what's right. Because it's for their safety, for their health, and that's the way I posed it to my mother. We're doing things to prevent problems for you, and some of these numbers might be helpful as you talk to people, talk to the folks that you're taking care of.
That's great. Christine.
I'm struck by the fact that community-based organizations are where the rubber hits the road. And our experience has been that, and our belief is, that older adults have the capacity to learn, to grow, to make changes in their life, to make good decisions. And perhaps we do need to advocate for them and give them a little push. As the adult child, I remember trying so hard to give my mother advice. And we all know that that's a role reversal that can be very difficult. So we know in marketing, we know that it doesn't take one message for anyone to make significant behavioral changes. It takes a community to do the work that we're talking about today. It takes all of us. It takes senior centers to create a buzz around this issue. But I do trust the ability of older people, when presented with good, solid, factual information, to make changes that will impact their life and make it better. I also feel that it's important to mention the kinds of stereotypes that we have about age, and we've heard some of those this morning. Older people themselves have beliefs about those age stereotypes. So it's not uncommon for me to hear an older person say, well, I had a lot of pain last night, but after all, I'm old. As though pain were a normal part of aging. And I think that's something that we really have to change in our community and with those that we serve. I also like to make a quick comment about the fact that we're dealing with multiple cohorts here. That I'm dealing with sometimes 3 generations of older adults. So by educating older people in the point where they have access, like community-based organizations, senior centers, nutrition sites, we may be finding that we get multiple impact because they are then teaching other older people in their sphere of influence.
Thank you. Betsy, what should a caregiver know?
Well, I'm going to change your question. You're probably not going to get to all 4 questions, right?
Excellent job. Pick what you want to answer.
Okay. I've been watching politics. I'm going to answer the question I wish he'd asked. Who cares what?
Oh, I'm so used to this.
Yeah, I know. I'm Betsy Abramson, the Deputy Director of Wisconsin Institute for Healthy Aging, and I do work for a fallologist. Dr. Jane Mahoney is a leading geriatrician like Dr. Barzee and really has specialized in falls and has done an awful lot of the work in bringing evidence-based prevention programs into clinical practice and bringing them from other places into Wisconsin. I don't know how many of you are healthcare providers. I've only, WEHA is only 8 months old, so I've just learned all this, and I spent 30 years as a lawyer doing public interest law for the elderly before I started doing this work, so I had to learn all the science terms. And that evidence-based clinical trials, everything I knew had been on the back of a Crest tube, and now I've, now I understand it's, da-da-da-da. So, as caregivers, I think a lot of the issues that other folks have said is true about looking at medications, questioning doctors, why another cocktail, why adding more and more of this to the cocktail, knowing these warning signs. One thing we haven't talked about yet is home review and home modifications. My mother, I guess, was a Irish twin of your mother's or something, and pretty much she's doing to me what my teenagers did to me if I said it, So, I walk around her house now all the time. Ooh, falls hazard, the boots sitting there and the wrong thing in the bathroom, blah, blah, blah. And I did notice that the last time I was there, I had taken off my shoes and left them in a doorway. And she said to me, "Isn't that a falls hazard, Betsy?" So, you just have to... Touche, I said to her. Anyway, I wanted to piggyback on Christine's point. We can do all we want, nudge, wag our finger, cry, we care so much, da-da-da-da-da. The whole we want you to be safe thing. That's what aging's all about, right? The balance between safety and autonomy. And what we're trying to do is, a lot of older folks think if they accept one thing, a grab bar is just the precursor to the nursing home. So it really has to be framed in a way that explains that, this is to help you stay independent. And this weird paradox that accepting some assistance actually makes you more independent than dependent. And then finally, I'll just mention, we are the statewide organization that brings some of these programs in healthy aging and prevention of chronic disease into clinical practice. Stepping On, which Dr. Barzee mentioned briefly, was originated in Australia, and it's a 7-week workshop for older people. So my big commercial would be, get older people to take some of the stepping on classes and the living well with chronic conditions classes that Jeannie Reeby from the Dane County Area Agency on Aging and Lynn Robertson out here are coordinating for us. It's not all the research shows, all the brochures, all the PowerPoints, all the everything we show older people and tell them isn't going to transform behavior. They have to believe. We have to create self-efficacy. Older people have to believe that they have the skills and knowledge to prevent falls. They don't want us coming home from somewhere and finding that we've pulled all the rugs out from under them, literally and figuratively. They have to believe that not having those rugs there will make a difference, have to be the ones to remove the rug, decide where, and that will build their confidence. Of the many things that we've talked about that falls can do, from your very tough story and others, one thing we hadn't mentioned really is the shaking of the confidence. And once your confidence is shaken, it's really hard to throw that leg over the horse and start again. And folks will then isolate more. I guess I didn't need to go to church. And stepping on is a 7-week workshop led by a healthcare professional and a peer leader, teaches balance and strength exercises that have been evidence-based to reduce falls. Completers of the Stepping On workshop have a 31% decrease in reducing hospitalizations and emergency room visits due to falls. They meet with pharmacists who come in and talk about all the medication issues. They learn how to do their own medication review. They learn how to talk to a doctor about they practice as if they were talking to the doctor. They learn about safe footwear. They learn about home modification. They learn how vision affects falls. My mom, the one whose daughter unkindly left the shoes in the middle, realized that her bifocals were one notch too low on her nose. That was a 30-second fix, and it's really helped her confidence now in the falls-related areas. So this course teaches you, safe footwear, better sleep, bone health, the intake of how much calcium and vitamin D, and helps folks learn how to do it themselves. And so I really encourage you, let's not forget about the older person and the techniques we know that older people themselves can pursue. Thanks so much.
That's great, and it speaks to what families can do. I guess I would just ask Christine if there's anything else you want to add, sort of in differentiating volunteers, friends, and family.
I like the point about looking over each other. I mean, there is a role that we all play rather than taking on the role of the lecturer, the educator, but becoming a partner with older adults themselves in the efficacy that Betsy was talking about. Exploring that idea yourself, and instead of maybe working with the older adult in their home, making a point of having them in your home and talking about why you put up grab bars. It's not just safety for older people, it's safety for everyone. When my father-in-law lived with us, he was shocked. This was the man that would not put a nail hole in a wall of his home for years. But we were installing grab bars, not only in the bathroom that he used, but also in our own. And we talked about it as though this is for our safety and yours. So it's a partnership we're trying to develop with the older people that we care about.
Andy, Robert, and Paul, would you just pick maybe between the idea of promising practices and what healthcare providers can do, and maybe cover those two areas just with some key points for us? Go ahead, Andy, if you want to.
Okay. There are some very definite practices that we know both for falls and ADE prevention, and I think, though, when you consider the role of healthcare professionals in the whole scheme of things, there are some things that we need to consider that perhaps we don't in the traditional model, and Steve had mentioned that, and that is the idea of extending and sort of making more global the way the healthcare professionals work, not only with each other, but with caregivers, with social service agencies, and so forth, and trying to get people to understand that the healthcare professionals can have a very vital role in preventing ADEs and falls, but it may not be the only role, and that they can get tremendous amounts of information from other community people who are interested and advocates for senior citizens. And in addition to that, I think the other role that we don't often consider is that the more physicians and pharmacists and nurses know about some of these public health issues, the more aware they are, which is going to be part of the United Way's effort, the more that they can help be convincers of senior citizens to participate. So Betsy mentioned Stepping On program. It'll be a great day when we have healthcare professionals who are much more aware of the value of that program, who can say to their senior citizen patients, gee, it would be a really good idea because I think you have some increased risk of falls. And what we hope is that through the United Way effort, there's going to be some risk stratification done by volunteers in people's homes, and that will then be communicated to the healthcare professionals, who can then take some actions with these community programs that they might not have been aware about before that time.
Yeah, that's great. Robert, something you want to, I'm sorry, Christy.
I just wanted to say that is such an important part of this campaign for nonprofit agencies in our community that are really facing very drastically decreasing budget. It becomes very difficult to promote these programs in the community. So to have an effort like this that includes media and focuses in on evidence-based programs that can make a difference in the lives of older adults, and to have the kind of help that community-based organizations need to promote these programs in the community is a major help. And I have to say, I wish Joe were still here, because in Dane County we have a wonderful system of community-based activities and case management services that are sometimes the best-known secret or best-kept secret. So to promote those community-based resources for families and older adults, and for the medical profession to direct families and older people to that resource, is a great help to those community-based organizations.
Yeah, and I got to tell you, Tom and I are both pretty excited about the work that we can do to help, through the media, promote this and raise awareness and education of this stuff. Robert?
Well, if you built the pyramid of good geriatric assessment, a building block or a foundation is a good medication history, a thorough incorporating all of the information that we can about an individual, an older adult's, a senior's medication taking history. That includes prescription medications, which we all know about, but often because of self-care, self-medication, there are herbals, over-the-counter medications, dietary supplements that are being taken that often healthcare providers, often busy physicians and nurse practitioners and physician assistants don't always have the time to get that thorough level of history that pharmacists in this program will have the opportunity to do through the comprehensive medication review and assessment. So that's not only a step forward in terms of things that we can do and meet the needs of our aging population, but the way that we can be partners and collaborate in the overall care and safety of our older adults. So those are things that we can bring to the table in trying to identify those medications that may be underused, overused, or misused by the older adult because maybe of their health beliefs, the way they use medications, mismanage or misunderstand the use of their medications. So through good adherence counseling, educational techniques, motivational interviewing, trying to overcome barriers or helping patients overcome barriers of poor medication taking behavior, incorporate the caregivers in this whole equation because often they're intimately involved in setting up medications, monitoring those medications, and are as much a partner in understanding the needs of those the indication for those medications and how they're supposed to be used properly. So all of these things we're grateful that pharmacists can bring to the table and participate in this project.
That's great. So Paul, last thoughts on either promising practices or what physicians can do?
Yeah, I'll keep it quick like everybody else. The cross-cutting issue, I think, amongst everything that's been said, is effective communication. Effective communication between a caregiver I would use broadly. That includes the doctor, the nurse, any person who has anything to do with the elder who's helping them in some way. Effective communication amongst that group, between each other, and then especially effective communication between the caregiver and the elder. And one of the things that we often do not do in the healthcare community, and I suspect a lot of other folks who are interacting with elders, is check understanding. We tend to give information, pat them on the back, and send them on their way, where we really need to be sure that they got it, especially around the issue of taking medications. And if you want to learn about how literacy and health literacy impacts the outcomes that we're talking about, which is all about effective communication, come listen to my talk.
In fact, I'm leaving a lot of unanswered questions, okay, that will be answered in the group meetings that follow this. But thank you all very much for taking the time to do this. I appreciate it. So as you're stepping down, Tom, would you mind coming up and sharing kind of next steps, the importance of the health message, and then we'll hand it off to Dr. Kossoff to announce our upcoming community projects.
Great. Thanks, Neil. As is typical when you go through these sorts of processes, community involvement, community knowledge, communication, getting the word out is always one of the bullet points that that comes out of the conversations. And then at the end of the day, the question is always how. During the course when the delegation was working, we are no different. We understand that as Steve was talking about when he was doing his presentation, one of the big things that I picked up off of his last chart before I had my seizure was an informed and empowered patient and healthcare provider was one of the key issues, or one of the key products we needed to have. So if we're going to get the word out and communicate with the caregivers and the olders and the older adults and the like, and many older adults, a lot of us in this room are not only as like Neil taking care of elderly parents, but this is looming on their horizon too. Just had to pick on you one more time. And so how do we communicate this? Well, Morgan Murphy Group, which is Channel 3 and Channel 3000 and Madison Magazine and the like, Wisconsin State Journal. My own company, Midwest Family Broadcasting, which is 1670 WTDY, Magic 98, and a number of other stations, have worked with Hebing, which is the advertising agency that United Way is currently using here in town, and Steve Mendez and his marketing group, and brainstormed messages and how we can communicate this. Now, picture for an instance that where, God forbid, that television, magazine, web, radio, and print are all dealing with the same message at the same time and communicating it in a coordinated fashion. Where, for instance, my people paint a picture in your mind. You're at your mom's house over Christmas or whatever, over the holidays, Thanksgiving, and you're in the bathroom, you open up the medicine cabinet, and you see a medicine cabinet full of 20 different jars of pills. Okay? That's a very easy picture to paint in television. It's a very easy still to have in the newspaper. And the call to action is the same. If you're back at home for the holidays and you see this, your parent is probably at risk for an adverse drug event and falls. Now your call to action, whether it's a 211 call or it's a call to the pharmacist for a medical review or the like. So what we're talking about is building a coordinated message between all three of these mediums, and then that mortar becomes something that we can keep dropping different messages in as we go through these falls and ADEs. And of course, this is brought to you by the campaign support people. And that's kind of the picture that we have as to how we're going to work with the community on this. Paint a picture and then a call to action and make these things very, very tangible to everybody in their home, whether they're a caregiver or whether they're the elder themselves. And WPS Health Insurance, M3, Solutions have already stepped up to partially help sponsor this campaign that we're working on, and we're working on other sponsors now. If any of you are interested, feel free to see Steve. He'll be happy to get your name and number. Wave to everybody, Steve. Thank you. And this was a very exciting project to work on together because figure the times that United Way can now pull these three mediums together, and Steve gets to herd all these cats as we're talking about building this message and the like. It's very exciting to us. We're looking at a fourth quarter kickoff for this, and at least running this as a 12-month campaign, and seeing how we do in getting the word out and what we can do to make everybody else's life easier by empowering and informing our patients and caregivers. That's what I got. Great.
You're up, Kusov.
Yeah. Thanks for that introduction. This is about as close as I'm going to get to the Walker fashion model. Pretty good, huh? First of all, having worked for years with a great organization, the Safe Communities Falls Prevention Task Force, I can say that this media campaign is much more important than I would have ever recognized, that unless we get the community focused in major ways on adverse drug events and falls, we're never going to make headway. And I think that's both the medical community as well as the general community. I just think it's an unbelievably important part of things. But enough philosophy for now. We're going to talk about some of the things that are underway from the work of the United Way delegation, and my understanding is that these are just the beginning things. Is that right, Deidre? I mean, there's lots more to come, but this is what's in place now from the work of the Safe and Healthy Aging delegation. And I apologize for reading, but Deidre said that if I didn't get these names right, that I'd be fired. Thanks to the Madison Community Foundation, we are now able to provide 500 low-income seniors with a comprehensive medication review by a network of pharmacists in Dane County. We want to thank the Pharmacy Society of Wisconsin, the Wisconsin Pharmacy Quality Collaborative Network, and the practicing physicians who will be so vital to this effort. This is really an important thing to have done because many times in our present healthcare system, people don't have the opportunity and time to carefully review and understand their medications, and this will provide that ability for many people who clearly couldn't afford that otherwise. The partnership among Safe Communities Falls Prevention Task Force, the Wisconsin Institute for Healthy Aging, and United Way is supporting evidence-based falls prevention classes to be available all over the county. And we also want to take a moment to thank SAIL for both their work on falls prevention and adverse drug events. They've been instrumental in the work of the delegation. And is Ann here somewhere? Ann Albert is back there. We are launching a community-wide volunteer corps through Home Health United to implement in-home assessments to assess the risk of adverse drug events and falls, and refer the seniors at risk to available resources in the community. The point being that if we can find a group of seniors that are particularly at risk, that may be where interventions are most effective. Home Health United is recruiting 100 volunteers from the community. They will train volunteers, schedule volunteer visits, help older adults and caregivers find resources to modify their home environment, and do follow-up. They will partner with 16 focal points, Safe Communities Falls Prevention Task Force, the Wisconsin Pharmacy Quality Collaborative, and pharmacies, and social service providers. So it's going to be an unbelievable collaboration of the organizations who are advocates for senior citizens. The American Red Cross is partnering with United Way to reach out to seniors and caregivers to raise awareness on the issue of adverse drug events and falls. United Way is just completing special arrangements with 5 community partners, including the North and East Side Senior Coalitions, to help older adults at risk for adverse events and falls to be connected with available resources. And finally, United Way we'll be forging a very strong partnership with all healthcare organizations in the community, because medical professionals will have a central role in reducing falls in ADE, and their leadership, participation, and counsel in this initiative are going to be very central to its success. So I think that's what's underway, okay?
Thanks, Andy, a lot, and thank you, Tom. Our final speaker then is Chris Decker, who is the Executive Vice President and CEO of Pharmacy Society of Wisconsin. The PSW is a statewide professional association for pharmacists, and Chris is going to introduce a very exciting project that our pharmacy community is currently working hard on to respond to this initiative. Please welcome Chris.
Thanks, Neil. I found in my career I've always had to fight the sort of the boyish image. I've got sort of the young face, or at least I did, I was told. And I see that there's another way I can continue that, sort of projecting that forward, is that I can use a picture that's 10 years old with my slide set. I can just keep that young guy look continuing. I also want to sort of say at the start that I thought it was funny. Dr. Kossoff was teasing Tom about his wear. And frankly, I was pretty jealous when I saw what you were wearing, because I know you're going straight from here to the tailgater, right, for the Badger game. As I start, I want to compliment the United Way. Our staff at the Pharmacy Society have been working with the United Way on the development of this project and the pharmacy-centric components of it. And the United Way team has been fantastic. I've watched mostly from afar. But we've had both Deidre and Hu Young. I haven't heard Hu Young's name mentioned yet, but she's the lead project manager and has just done tremendous work. I know they've had at least a dozen meetings in our office, let alone how many meetings have occurred outside of the PSW office. With our staff, Carrie Trapskin on my staff has been the project lead. Dozens of pharmacist volunteers that have been contributing their time over the last 6 months or so as this project's been developing. I just have a few slides to review with you to show what's going to happen on how the pharmacists are going to work to be engaged in rolling this program forward. We've talked a little bit about the challenges associated with managing medications and the risk associated with medications. You may be interested to know a statistic. There's about 100 million prescriptions dispensed in Wisconsin each year. 100 million. So lots and lots of prescription drugs. It's the #1 most cost-effective form of medical treatment available to us. That's good. I mean, it's really good that we have these advanced therapies available to the physicians and medical community to treat patients that need to be treated. It helps with prevention, helps with treatment, and in some cases even cure. You also may be interested to know, on average, the number of medications an individual takes, that a consumer takes, doubles every 15 years, beginning at the age of 35. So at 35, a 50-year-old takes twice as many medications as the average 35-year-old. And likewise, a 65-year-old takes twice as many as the 50-year-old, 4 times as many as that 35-year-old. And then you make one more jump to the 80-year-old. Now that 80-year-old, average consumer is taking twice as many meds as the 65-year-old. So you can see how the numbers get pretty big for any given individual at once. And I've really been struck by, when the project brought to my attention, the number of meds that it takes for 100% certainty of an adverse drug event. If you take 8 or more meds, 100% certainty of having an adverse drug event. So we've got some significant area to look at and to consider as we manage patients taking those multiple meds. We've talked a little bit about these adverse drug events being preventable. I won't go through much more on that, but I'll say that we've learned that it's one of the most common adverse drug events, one of the very most common reasons for people to be admitted to the hospital. One of the most common reasons for people to fall are due to adverse drug events. What we haven't mentioned is that it's also not so much just the adverse drug event, but the challenge associated with managing medicines in the first place. Just the overall ability when people are taking 8 and 10 and 12 medications, just the management of those medications is one of the #1 reasons for people to be admitted to a nursing home. It's just they need help with their medicines. And with a realignment in our healthcare delivery system, as Dr. Barzey talked about, changing the structure, changing the support system, we can do better than that. And that's what this project's designed to do. I wanted just to share with you a little bit of it's been referenced, the Wisconsin Pharmacy Quality Collaborative. It's likely a new initiative to most of you. It's an effort that our society, the Pharmacy Society of Wisconsin, has advanced. You can go to any pharmacy in Wisconsin and receive a prescription. If you have a prescription order, you can receive a medication from any pharmacy. But not from every pharmacy, at least today, can you go and schedule an appointment with a pharmacist and receive assistance with questions and challenges a patient may have with their medications. The Wisconsin Pharmacy Quality Collaborative is designed to create that group of pharmacies. It's a subset of the larger pharmacy community where a patient can receive a higher level, an enhanced level of service, often by, not always, but often by scheduling an appointment with a pharmacist. The pharmacists are available for an appointment in the pharmacy for patients that need that enhanced level of service. We have 25 pharmacies in Dane County already that have enrolled in this WPQC program and will be making themselves available to the United Way project to provide that enhanced level of service. This project, the WPQC program, was launched about 2 years ago with 2 private insurers in Dane County, Group Health Cooperative and Unity Health Insurance. Both saw the need and value of making that enhanced benefit available to their insureds. And they've been working with us and these pharmacies to enable the provision of those comprehensive medication reviews. Some of those pharmacies, you'll receive a list of all the 25 pharmacies, but some of them are here in the room. The UW Health pharmacies, all of the UW Health pharmacies are enrolled in the WPQC program. Malott Pharmacy on Monroe Street has been a pioneer in this comprehensive med review program. The hometown pharmacies throughout Dane County will be participating. And one group that's been real significant in their contribution to the development of this program, focused on seniors in particular, has been the pharmacy at Oakwood Village, who works almost exclusively with seniors, and they'll be participating in the program as well. I also mentioned that Wisconsin Medicaid, the Department of Health Services, has announced that it will be enrolling all of the Wisconsin Medicaid recipients statewide into the WPQC program. It'll be available to them, as well as senior care. So pretty soon this program is going to be moving from outside of Dane County to a broader statewide reach. So you may question a little bit, well, what happens with this comprehensive med review? Schedule an appointment with a pharmacist. What is it that the pharmacist is going to be looking for and doing in that process? They're going to be looking for meds in the seniors in particular that are contraindicated. There's some drugs that seniors just shouldn't be on and find themselves on. Sometimes they're medications they've been on for some time, and as they age, they're contraindicated, and sometimes it's a medication that was just prescribed for them in the first place. So we're looking for areas where they can to discontinue medications that are contraindicated. Many patients, especially those that are taking 8 and 10 and 12 medications at a time, are receiving those medications from multiple healthcare professionals. They're prescribed by different doctors. And oftentimes, as Dr. Barzey talked about, oftentimes there's not a good understanding amongst the health professionals about what each other are doing. And even when there is, there's not a complete awareness and an analysis and consideration of what's happening. Are any of those medications that the patients are taking contraindicated because of one another? The adverse drug events we've talked about, prescribing cascades we haven't touched on, but it happens not frequently, but it does happen commonly where a patient will receive a medication that's prescribed for an indication that's caused by another medication, a side effect of one medication. A side effect may be that a patient has insomnia, they have a hard time sleeping, and they receive another prescription to treat the insomnia rather than treating the removing perhaps or changing the first prescription in the first place. So pharmacists will be looking for the challenges associated with problems from that prescribing cascade consequence. They'll also be looking for ways they can help patients reduce their costs with medications. The average brand name drug now is $100 a month more than the average generic medication. $100 a month, one medication. So again, if you have a patient taking 10 and 12 medications, it's not hard to see where you can really reduce costs of therapy to the patient if they can maximize the use of generics or select a less expensive therapeutic alternate if there's one available. And then lastly, adherence. We have just completed, I received a report just yesterday that on a study that the Pharmacy Society of Wisconsin completed that looked at adherence. And we found, you maybe have heard, that about half the patients half of consumers aren't adherent with their medications. And in fact, the study that we just completed bore that out. 49% of the patients that were evaluated had said they'd forgotten to take their medications. They just had forgotten to take them. They weren't adherent. They'd forgotten. It's common. 30% had not filled a prescription that they had been received, that they'd been prescribed a drug and they didn't go to the pharmacy to ever have it filled. 30% stopped the medication on their own. 30% of the patients in the survey that were surveyed had stopped the medication on their own, and 25% just decided on their own to take less medication, to sort of stretch the prescription, to take a smaller dosage than they otherwise would. All of those things with negative healthcare consequences potentially occurring. So what's going to happen? Pharmacists are going to be able to intervene because of this United Way project for patients that otherwise wouldn't have access to that service. United Way is going to provide support for those patients to be able to schedule an appointment with a pharmacist in the WPQC program, and the pharmacist to provide those services. But they won't do it in isolation. They'll do it either as a referral from a physician or another healthcare provider, and they'll be able to provide, and in all cases will provide, a report back to the patient's primary care physician about what the findings are. So there's going to be a coordination of that care between the pharmacist and those prescribing the medications. And lastly, we anticipate that we'll see a greater team approach that will grow out of this project. So the Pharmacy Society of Wisconsin, we're pleased to pledge our support to this innovative county initiative. We're hopeful that it will grow and that it'll be able to be replicated in other communities across the state. So you have our support, and we want to thank you for your leadership. Thank you.
Thanks very much, Chris. Clearly, your participation in this is so important. A couple of last points I want to make here. In your folder, you received a small card called a medication wallet card. And it's to help older adults carry the full list of medications with them in their wallet and purse. And most of you probably know why this is so important, but it gives emergency medication personnel information that can save older adults' lives, in a hurry. It's important to take a full list of medicines when older adults visit doctors' offices. It's important that older adults let caregivers know that he or she keeps the list of updated medications in his or her wallet for the emergency. So we just want to bring that to your attention. The form is downloadable at United Way's website, and you're more than welcome to contact United Way 211 or staff to get more information about copies of this wallet card. So now you're going to learn more about the practical knowledge and skills regarding adverse drug effects and falls at the breakout session. These are the rooms where the session is taking place. Social service providers stay right here. Healthcare providers go to room 122. And older adults, caregivers, or volunteers go to room G216. United Way staff are available to help you find those rooms. I want to thank all the presenters. It was really an impressive list of presenters who were here today. And just, a final observation that, as always, United Way has convened a community conversation about a really important issue. A lot of volunteers, a lot of groups coming together to work on this, and it's that same theme that working together, we can really make a huge change in the quality of life in our community. So thank you all for coming and joining in that. Good work in your sessions coming up here today, and enjoy the rest of the day.